Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about hypertension and its multitudes of problems to the human body. When I left off last week, I was talking about the effect of hypertension on the heart. In this segment, I'm going to wrap that up, but before I do so, I want to again give you an overview that hypertension, 1.5 billion people in the world suffer from hypertension. In this country, 103 million people suffer from hypertension. One of every three adults in this country suffer from hypertension. And the Negro community is one of every third adult suffer from hypertension. Now, hypertension basically is at the root of a series of conditions called cardiovascular disease. Now, cardiovascular disease includes, of course, hypertension, atherosclerotic heart disease, and stroke. Every single year in the world, 17.5 million people die as a result of coronary, not heart disease, but the whole concept of coronary heart disease and strokes and hypertension. Now, in this country, you have close to 950-something thousand people died of the combination of hypertension, atherosclerotic heart disease, and stroke. Cardiovascular disease is a short term for that. Now, what happened is that once you have hypertension, there are many, many, many conditions that play a role in the development of hypertension besides just the genetic phenomena that you were scheduled to have it and you're going to have it. As a matter of fact, I usually tell my patients, all you have to be a Negro person and live long enough, you're going to develop hypertension. Well, what happened is that the different things that may be associated, of course, with hypertension. Number one is the genetic predisposition, diet, i.e. the salt in the diet, the simple carbohydrate in the diet, these things that can lead to obesity, which is in this country an epidemic. Of all developed countries in the world, there are more obese people in the United States of America than in any other developed country, and we only represent about 5% of the world population. There's only 329 million people in this country. In addition to that, of course, you have stress. Then you have poverty. Stress is a major problem because when you are under stress, you over-secrete adrenaline, and because you over-secrete adrenaline, that's one way your pressure goes up as well. And depending on the constant nature of the stress, then of course it goes without saying that you are at a higher risk of hypertension. That's one of the reasons why in this country, one of every two Negro adults individuals suffer from hypertension because these folks are under constant racial discrimination stress of different types, different manifestation of it. It doesn't matter how educated you are, how professional you are, for that matter, how much money you have or what your achievements are. If you are an individual of color, you live in the United States of America, you face constant racial discrimination of one type or another. That's it. This is the greatest country, as far as I'm concerned, in the world. But at the DNA of it is this intense, constant, non-stop racial discrimination. As soon as people hit the airport, wherever country they're coming from, as soon as they hit the airport, no matter what the mentality or where they're coming from, once they come here, automatically, if they're not an individual, a person of color, they know automatically in order to survive, to have a better social advantage, political advantage, they must join the racial discrimination syndrome that exists here. And that's it. Otherwise, they're going to be outcasts. So they come here to get better, for a better life. Well, that's what they're going to do in order to achieve that goal. I know it's a broad statement, but that's unfortunately the majority. That's what they do. Those who don't, they're a rare minority. I know because I'm a person of color. I'm a Negro, and I know how much I've done for this country, how much I've done for this world, how much this country has done for me, and yet 24/7. As a matter of fact, I dare say I practice medicine in this beautiful place called the County of Westchester. And you would have to look very hard to find another physician that suffers from racial discrimination more than I do, for doing absolutely nothing, for being who I am, what I am. That's all that was necessary. So that's stress. And then, of course, talk about poverty. If you are a poor person, you live in this country. I know poverty all over the world is a major problem, but this is the country that I live in. This is the country, this is my country. That's the country, the statistic that I'm more familiar with. If you're a woman and you're in the minority, you're a poor person, you guarantee to live 10 years less than a person who's not poor, for a multitude of reasons. If you are a man and you are poor, you live in this country, you are guaranteed to live 15 years less than the person who's not poor. And that's, of course, one of the main reasons is the stress, the poor diet, the lack of financial capability to pay for proper medical care is at the center of this. So this is a reality. This is not theoretical. This is thing that people are dealing with every day. So all this combination of things lead to the syndrome that I'm talking about, which is cardiovascular disease. And that is why it is one of the leading causes of death in the world, and it's one of the leading causes of death in this country. Close to 1 million people every year, 950-something thousand plus, died of a component of cardiovascular disease every. As a matter of fact, about half of the adult population in this country suffer from one component or another of the cardiovascular disease that I just talked about every day. More than half, or close to half, of the adult population in this country suffer from that. But at the center of it is a disease called hypertension, which is the easiest disease to diagnose, the easiest disease to treat. Once you understand the disease, once you take the time to know how best to treat it. Which then lead me to another organ that is constantly being affected by hypertension that leads to a lot of problems, namely the kidney. The kidney is a fantastic organ. The kidney is not just there to excrete urine. Many, many substances that are necessary to maintain good health are in fact produced by the kidney. The kidney is just not an organ that receives the garbage that's in the urine and urine it out. It does that too. But in addition to that, serious medical stuff that we need to remain healthy is produced by the kidney. In addition to that, serious medical problem that we have to treat, we can't treat them properly if we don't go through the kidney to do so. How about that? You say then, how do you go from hypertension to kidney damages? Well, I'll go through it again. I explained to you last week how you develop occlusion of vessels because the pressure is elevated inside the vessel that then causes the vessel to be damaged. Well, we were all born with a specific quantity of a substance that is located in the kidney called the glomeruli. The glomeruli are really the substance that allow the kidney to function. And each little glomerulus has a little vessel, no matter how tiny, or a group of glomeruli, as little vessels that are responsible to bring blood and oxygen to them to keep them healthy so that the kidney can function properly. And then unfortunately, once you lose them, you don't replace them. You cannot replace your glomeruli as an adult. That's it. You were born with that quantity. You must do everything you can within your power to preserve that quantity so as to keep your kidney function. There are many medications. There are many conditions such as high cholesterol or slight hyperlipidemia, diabetes mellitus, hypertension, and a whole host of other genetic problems, hereditary problems that one were born with that can affect the kidney, causing it to be sick, etc. The list is quite long. These two books in front of me, The Art and Practice of Modern Clinical Medicine, I think was I believe I wrote this book in 2016. And this book, The African American Woman's Health, this is the 2019 book. Okay, I write a book or two every year. There are chapters, several chapters, dealing with different aspects of kidney conditions that are listed there, outlined. Every single day, even on Saturday, I'm getting multiple phone calls from different publishers, publishing houses, wanting me to let them distribute these books for me. Unfortunately, I'm not in the book writing business to make money. That's not who I am. That's not my interest. I write book as an academician to make intellectual contribution, etc. If this individual were going to distribute the book and get a percentage of the seller of the book, I would go along with that. Problem is, every one of them want me to buy a book distribution package which costs several $1,000s with no guarantee that I'm going to even go back $100 back. On top of that, the laughable part of it, I would buy the package, which I did once, and I wasted the money. Then, listen to this, every book they sell, in addition to paying them for the package to distribute the book, I'll never get that money back. Then they get 80% per copy. You can't make this up. I would back that, which I did a couple of times, would buy this distribution package. Once I give that credit card, that's it, several $1,000s, never see it again. And then each book they sell, you can't make this up, they take 80%. Now, I would have to be a fool to go along with a program like that. So that's the reason why, in addition to, that's not my interest to begin with, that you're having difficulty putting your hand on this book. But if you're in the academic world, I distribute them to the different academic places where, because that's basically my main interest, is for the medical students, the interns and residents, and some of the young attendings who want to learn what is the best way, not only how to practice medicine, but what is the best way to practice medicine. I'm sure it's like that in every profession. There's always a good way to do something, a superb way to do something, and an outstanding way to do something, okay? And I wouldn't be sitting here talking to you the way I'm talking if I didn't know what is the best way and the outstanding way to do it. Because first of all, I probably wouldn't have a license to practice medicine because hundreds of times they've made effort to shut me up by doing nasty criminal things to take this privilege for me that I earned to practice medicine because of my skin color and this incredible gift of brain power that God gave me. They wanted to take it away. Well, in America, nobody is above the law, and you're going to have to prove what it is that I've done wrong. And in the process of doing so, many people have gotten hurt. I have done nothing to hurt them. They hurt themselves. And believe me, several of them have gotten hurt very, very, very badly, sadly, because they won't leave me alone. And when they do the stupid things, this unsophisticated Haitian peasant has so much brain power, it is inevitable that I'm going to discover what it is they did. And once I do, what do you think I'm going to do with the material? Turn it over to the authorities, only to find out that it was a bunch of lie. And the last thing you want to do in this world, don't lie. Because if you lie, once you get caught, everything else thereafter is not believable, and you're going to be punished for lying. And this year I think, a law was signed, I believe, by the governor of New York. You cannot retaliate against people in New York State and the healthcare system. If you did not know, you just found out. You cannot retaliate. There's a non-retaliatory law that was passed. They didn't name it after me, but they could have if they wanted to. And I would not bore you to sit there to tell you the detail how that law gets to be. You cannot retaliate against anybody who found you doing something wrong in the healthcare system, whoever that person is, and reported it. You cannot. It is now illegal to do so in New York State. When there was no such law, I was at the center of this ugly, evil, and criminal activities to get rid of me for doing nothing. Had I done something, that would have been different. Therefore, then, I'm saying to you, don't lie. First of all, do not do anything dumb and stupid and hurtful to other people, and don't lie, because you're going to get caught. Because people are not as smart as they think they are. They're not as intelligent as they think they are. They have power, yes, they have money, but power is not necessarily the same thing as intellectual brilliance. So you can't buy intellectual brilliance. You either were born with it, you develop it, or you don't have it. And a lot of these folks who don't know this, they're just simply a bunch of damn fools who are privileged in other ways. Therefore, the kidney then is a crucial organ as it relates to cardiovascular disease, because even though it's not part of it, but it's affected by it, because if you have heart disease, the heart disease can affect your kidney. If you have hypertension, hypertension definitely will ultimately wind up with your kidney failing if you don't treat the hypertension. You say, well, how so? Well, those tiny little glomeruli have to get their blood flow so that they can get the oxygen, so that they can remain healthy, to keep the kidney healthy. There are many, many things that can cause the kidney to be unhealthy. I'm talking about blood flow. So once the pressure becomes elevated inside the tiniest little vessel, that high pressure inside those little vessels is going to cause them to develop tiniest little plaque, because that little aberration that occur inside a tiny little vessel will then lead to a local tiny little inflammatory processes. Those processes, once they're inflammatory in nature, the ultimate end result is the formation of plaque. Once the plaque develops inside a tiny little vessel, whose job it is to carry blood to that part of the kidney to feed the glomeruli, that cannot occur properly. The glomeruli begin to die out. Here's the danger. You're minding your own business. Your kidney function looks pretty good. We do the blood test, it looks pretty good. But you're losing glomeruli, you don't know anything about it, because there's no pain involved. There's no pain involved. We have ways we could tell if we do some specific test for the kidney, but we don't do these things routinely on everybody. Doesn't make clinical sense unless we begin to see some abnormality begin to develop in the kidney function test. So it's like the blood urine nitrogen in particular, and the creatinine. Then we become a little suspicious. Something must be going on. And that something could be any number of things, hundreds of different things. Because when you're losing those glomeruli, there's no pain, but they're dying out. You're dropping off glomeruli. You have billions of them, but they're dying, you don't know. You have no pain. Until one day, something happened, you wind up with an infection of the kidney. Or one day, something happened, you lose your blood pressure because you get into an accident, you get an infection, you went into shock transiently, who knows, or you become severely dehydrated for whatever reason. There are many reasons that people become dehydrated. Suddenly, you would have expected that little abnormality to be transient. It doesn't happen. And suddenly your kidney function out of the blue becomes abnormal, and you do all the usual things, they don't get better. Yeah, they don't get better. That's when the red flag rises, oh my goodness, something was wrong with the kidney. That something may very well be is because you were hypertensive, the blood pressure was not treated properly, and that then was affecting the kidney without you knowing it. And bango, the kidney began to deteriorate on different stages. And you do all the usual fancy stuff we do to try to see if we could bring that back. It didn't work out. So you call your nephrologist. He or she comes in, did all this incredible amount of tests that these people are very good at. They know what to do. Aha, now you have renal insufficiency. Now you have renal insufficiency. Suddenly, out of the blue, you realize, oh my God, the blood pressure has really needs to be handled properly. And then also, now you got yourself another problem. There's a long list of medication you cannot take. If you take them, they're going to make the kidney function worse. Your best medications, i.e., for instance, your water pill. Suddenly, oh my God, you can't get the water pill because if you get the water pill, it may make the kidney function worse. There are ways of doing it, but I'm not going to bore with that right now. And now you're stuck. So the long list of medications, such as an ACE inhibitor, you can't go there because your kidney function is not working properly. As a matter of fact, when the ARBs, which are this most fantastic blood pressure pill, were available, now they're not available anymore in this country because of this contamination issue. You can't even use the ARB. Because if you use an ARB and your kidney function is not so good, it's going to make it worse. It's going to cause the potassium to go up. It might even cause the BUN to go up. And now you can't use an ACE, okay, and they are plentiful. Now you cannot use an ARB because the ARBs are no longer available. Even when they were available, you couldn't use them if you have renal insufficiency because it would make the renal insufficiency worse. And they were just a fantastic medication, multi-ethnic. Any ethnic group can use an ARB, and now you cannot use it if you're kidney. So your hands are tied. Now you're left with some calcium channel blockers, a little bit of twist and turn, a little bit of alpha blocker, all sorts of fancy things that you have to know what to do. Like cut here, paste there to try to bring the kidney down. You're forced now to use, nitropase or nitroglycerin type thing, all sorts of other things to try to bring the pressure, all sorts of stuff that we know how to do to bring the pressure down. It's not easy. And you really have to be very smartly up to date to know how to navigate through how to treat somebody with hypertension whose kidney function is now deteriorating. It is very difficult. And all that could have been avoided if, number one, the patient goes to the doctor. Can't blame the doctor, the patient doesn't come. And when he or she did go to the doctor, he or she got the appropriate care. That's crucial. And that's very important. First, you have to go. If you don't go, you can't blame the doctor. The doctor does not have the right to just grab you in the street and start treating you. You have to sign document giving us permission to treat you. This is a very serious business. And then when we do, then we have to then give you the proper medication, and then you have to adhere to it. Can't blame the doctor if you're not adhering to the information, to the treatment he or she is prescribing for you. Taking all that in the real world, living that we're not really living in this beautiful world the way we think it is, then you got your problem. And there are many, many, many diseases having nothing to do with hypertension that can damage the kidney. In this country, 9% of individuals suffer from sickle cell disease to one degree or another. Well, you can't have sickle cell disease, don't ultimately wind up with kidney disease. How about that? So all these people, okay? And all of them are in the minority / people of color group. They already have this predisposition to hypertension, and now they got sickle cell disease they were born with. On top of that, now you got to be sitting down to hear this one. 90 to 95% of all individuals of color have low vitamin D. You say, but Val, how do you go from low vitamin D to hypertension? Are you ready for this? Okay. Academic medicine teaches you the big difference that if you have low vitamin D, you have to listen to this. 90 to 95% of all individuals whose skins are dark, no matter what they think of themselves, have low vitamin D. Low vitamin D, my friend, causes overactivation of the renin-angiotensin-aldosterone system. How about that? So now you just found out now, one of every 2 adult Negro individuals have low hypertension, have hypertension, and 95% of these folks have low vitamin. They don't even know anything about it. In fact, most people don't even test them for it. How about that? So how are you going to treat the blood pressure? You're running all over the place, can't figure out how to treat it. It's not responding. Something as simple as testing the vitamin D, my friend, would realize that if you have low vitamin D, if you didn't know that, you just learned it, that causes the overactivation of the same system you're trying to block to bring the pressure down. Come on. I mean, do you have to be a genius to figure that out? I just finished telling you, not only that 90 to 95% of these people have low vitamin D, 75% of them have lactose intolerance, myself included. And if you have lactose intolerance, you cannot eat or drink the thing that have the most vitamin D in them. How about that? Which is milk, ice cream that has milk, cheese and all that stuff. Listen, I'm stopping here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.